Next chapter is right now audiology. Tympanometry and stapedial reflex test. Okay. So in a case where I see that a patient comes with intact ear, a patient comes with ear problem, but he has intact pinna, external auditory canal, and tympanic membrane. That means a patient comes with intact pinna, external auditory canal, and normal tympanic membrane, and I find through now, so I can say that there is no problem in the external ear. So the problem must reside in the middle ear. That means here comes my occipital chin, and problem must reside in the middle ear or inside the inner ear. Okay. So in that case, through Rini and Weber, I can distinguish the problem resides in where, middle ear or inner ear. Now, to find out the condition of the middle ear, that is middle ear, we do impedance audiometry. Obviously we know the work of middle ear is impedance matching, so we do impedance audiometry. We have two tests here. One is tympanometry and other one is stapedial reflex. We know stapedial resides in here. Stapedial reflex. Now in tympanometry, what is done, that three probes are sent inside. One probe sends a sound, the second probe receives the sound, and the middle probe changes the pressure inside this ear canal. The best reflection comes when the pressure inside the external ear and middle ear is actually equal. So by through this we can actually understand the pressure of the middle ear. So we have three things that when will be the best transmission, when the pressure inside and pressure inside and outside will be similar. Okay, now here we know comes the Eustachian tube. Eustachian tube. Okay. So there are certain conditions only that can happen in middle ear. In case that compliance increased implies that simply mobility increase is equal to dancing increased seems more. So it is as dancing more, and we can simply say that discontinuity of ossicular chain. Ossicular chain means simply the heartbeats. These heartbeats are discontinued, so obviously this was stretched back. Now it is moving too much. So ossicular dancing too much. That means compliance is more. So there is obviously another scenario where basically another scenario where compliance is less. Compliance is less, that means it is more or less fixed, it is not dancing properly. So there can be two scenarios here. One is that the simple one, that this oscillator chain is fixed. So fixed oscillator chain, fixed harddy, fluid inside this. So fluid will cause what thing? If it is fixed harddy, then obviously that pressure inside and outside will be same. No pressure change, that means normal pressure. It is normal pressure. If fluid is accumulated inside this, then eustachian tube will be blocked. So pressure will decrease, implies that eustachian tube blocked. We can check the pressure in tympanometry. Pressure can be changed from -400 to +200. Pressure change, pressure can be changed in tympanometry. This is the question of previous lecture. Now obviously comes that what is the normal pressure. Okay, so the normal pressure is +50 to -50 in adults, and +50 to -150 in children. This is for adults, this is for children. What is the normal compliance? Normal compliance is 0.5 to 1.5. Normal compliance 0.35 actually, but just write this to 1.45, but we will write this milliliter. Okay. This millimeter Hg also, millimeter Hg, millimeter H2. This was the tympanogram. It is an objective test, tympanometry. This was the tympanogram for normal scenario. If it is for normal scenario, the plot will be up to the middle of the page, and it will be said A for normal pressure, normal pressure and normal compliance. Now if pressure is normal but haddies are more or less fixed, that means haddi fixed, pressure normal, this will be short one. A is means A for always air pressure, and it is normal. So normal pressure, but compliance decreased in case of ossicular fixation, that means otosclerosis. Tympanosclerosis also is for stiffness. So I can say that is for stiffness. If it is dancing too much, that means too much of dancing Air pressure is normal, A for air pressure normal, but dancing too much, so AD curve, so capital D, AD curve, that means dancing, that means discontinuity, AD curve is discontinuity, oscular discontinuity, maybe have some trauma. Now if the fluid is accumulated in any case, so I can say that the tympanogram will be dome shaped. So this is B curve, that means fluid here, obviously it is positive, it is negative, so air pressure will be negative, compliance will be negative, or decrease actually. It will be dome shape and seen in where obviously otitis media, serous otitis media. Now it will be more or less flat. If the early stage of gestation tube, there will be a C curve. C curve will be most likely same. It will be just a little bit higher. Like this is C curve. It is also pressure is negative, means fluid starts with zone shape, starts to accumulate. If the tympanogram shows a flat line, if it shows a flat line, there is two possibilities. Obviously one is simply it was like that, then it will be domed, then it will be flat, that means there will be flat, means too much fluid, or the tympanic membrane is perforated, কানের পর্দা ফেটে গেছে, there's no tympanic membrane. So this is overall tympanometry. This is a tympanogram. It is an objective test. Important question. Here are some samples from the book. If we see here, there is in this box, this means normal compliance. If the graph simply comes to the middle of the page, and it means normal air compliance and normal pressure. This is the pressure, it is the compliance. Here it is compliance. So if I make two lines, this line is for pressure and this line means half. This is for compliance. Compliance means simply movement. So both are same, so it is a normal curve. A means all is right, A means air pressure is right, and there is nothing beside that, so everything is alright. AD curve. So here the compliance is too much. Compliance is too much, that means it is dancing too much. Dancing means discontinuity. Discontinuity. Next, here it is the normal one. It is shifted in this negative part too much, so we can say it is the C curve. because still I am having some pointy things. If it is dome shape, then I will call it picro. So it is right ear. Obviously it is in the negative side, that means fluid is here. Negative means fluid starts to accumulate, and here is flat line, means there is two possibilities: one, too much fluid, or there is tympanic membrane perforation. That means no mobility in the tympanic membrane. Next we have the Valsalva maneuver, we have the Politzer test, and Toynbee maneuver. All these are for our jugaad technique. So we have, it is the best one, tympanometry. We also have Valsalva, in Valsalva what is done, that simply close knock and nook, push here, tympanic membrane pops out. Here the question is, no throat infection should be there, no throat infection, otherwise it will infect the middle ear. Should be there. Next, Politzer method. Same as Valsalva, we just pump here in nose, in the exact same thing once again. That means this is the mark, and we pump here. Okay. Next, Toynbee method. Here patient is asked to sip a glass of water, and obviously patient close the nostrils and swallow the water. Now negative pressure is created, the eustachian tube comes inside, causes a negative pressure field inside, and the tympanic membranes can be seen through otoscopy is pulling inside. So it is pulling inside. Here the tympanic membrane was popping in Valsalva and Politzer. In Toynbee, the tympanic membrane pulls inside. So Toynbee, we give water, swallowed, নাক মুখ বন্ধ once again. So negative pressure, and tympanic membrane pulls inside. Next is eustachian tube catheterization. In this catheterization process, we actually go to the eustachian tube physically, and then we apply air through this nostril. So it simply helps. Next is Frenzel maneuver for diabetes. The best test for eustachian tube is tympanometry. So next two is eustachian tube catheter, and the last one is Frenzel maneuver for diabetes. Question is best method for eustachian tube function, that is air pressure maintaining, is obviously tympanometry. Next comes to stapedial reflex. In the stapedial reflex, we have already known that if there is a very loud sound anywhere, then we have the stapedial reflex. It goes through 8 and comes through 7. When the loud noise should be 70 to 90 decibels. Okay, so first understand the pathway of stapedial reflex. So the afferent pathway of stapedial reflex looks like this. First, the sound comes from external auditory canal, then to the middle ear, then it comes to the inner ear. Then from there it is picked up by auditory pathway, where it goes to the superior olivary complex. Superior olivary complex. It is the center for stapedial reflex. Then it comes via the efferent nerve, that is facial, and travels to both ears. It is facial nerve, that means here it is the 8th cranial nerve, here it is the 7th cranial nerve. It comes to both ears, stapedial muscle, and contracts the stapedial muscle, so that sound is dampened. So this is the stapedial. It is the oval window, it is the stapes. So stapedial reflex is also an object testless test. So if I just check the right ear, then I am checking stapedial reflex, I am checking the right ear. Just write the questions. So let's face some problems. We have just very few conditions, like if middle ear conductive hearing loss is lost, then stapedial reflex will be lost. So external auditory canal, then I have middle ear, and if there is any problem, like obviously like this, otitis media or otosclerosis. So middle ear problem like otosclerosis, otitis media, stapedial reflex will be lost. No stapedial reflex. Okay. Then external ear, we come to the middle ear. That means in the cochlear sensory or cochlear hearing loss. If sensory or cochlear, obviously it is a cochlear or sensory hearing loss, then what will happen? The threshold of stapedial reflex will be less. Threshold will decrease for stapedial reflex. Next comes to the neural part. Okay, this part. So neural or retrocochlear, retrocochlear or neural hearing loss. What will be seen? The stapedial reflex delay. Next, if there is facial nerve palsy, then obviously stapedial reflex will be lost in that respective area. Where in the horizontal segment. Facial nerve palsy or seventh nerve palsy, stapedial reflex will be lost in that respective area. Where in the horizontal segment. If we check the stapedial reflex for stapedial reflex for right ear, I am testing the 8th nerve of the right ear, that is 8th nerve, vestibulocochlear nerve of right ear, and 7th nerve of left and right both ear, left and right ear. So these are the questions.